Our last speaker for this morning's session, we're very privileged to have Dr. Elaine Bernard. Dr. Bernard served as Executive Director of the Labor and Work-Life Program at Harvard University from 1989 to 2017. She has conducted courses on a wide variety of topics for unions, community groups, universities, and government departments, and her current research and teaching interests are in areas of international cooperative labor movements and the role of unions in promoting civil society, democracy, and economic growth. Dr. Bernard will present on the story of the United States.
Kevin spoke about the perfect storm that we faced here in the United States, with a real focus on the degree to which the healthcare industry was prepared or not prepared, and the response. What I'm going to look at is a slightly different perspective, and that is the U.S. socioeconomic environment within which this crisis appeared. And some of the problems we're still facing today, and we will continue to face, are based on some of these wider socioeconomic environmental issues. A very large one, of course, is we're a very unequal society. We have high levels of income inequality in the United States. One of the ways economists measure inequality is with a thing called the Gini coefficient. And if you look, our Gini coefficient is at a number close to most very unequal societies. We're closer to Brazil than we are to, say, Canada or Germany or France as far as inequality. And this is not just inequality between workers and bosses. There's also a huge racial dimension to inequality in America. And this, of course, will later play out in who is hardest hit around COVID. As you can see, in the US, there's a huge income gap between whites and blacks. In the US, there's huge racial disparity also, not just in income, but also in wealth. And why wealth is important is because for most working people, wealth is measured by usually having a house, your accommodation, and by pension savings. And in both instances, huge gaps in the United States racially. And of course, accommodations then become very important. If you're in concentrated accommodations, more crowded, this is where we saw some of the worst outbreaks of COVID. When we look at our healthcare system from an economics perspective, we're number one. We put more of our GDP into health expenditures than any other country in the world. And you would think with such high expenditures that we would have the best system for all of our people. But if you look at how even Americans measure the quality of healthcare and access, we're again below most advanced industrial countries in satisfaction, in access, and in quality. And all of this is what existed before COVID. And when COVID arrives, we also still had a very profit-oriented, fragmented healthcare system. Only 3% of that amount of money that we put into healthcare, but less than 3% goes into public health care. There's little coordination between national, state, and local health departments, with some 2,800 local health departments across the country. And in a situation where coordination and common information is so important, we again have such a fragmented system that hospitals and clinics have proprietary electronic records. They don't communicate, don't share with authorities. And as Kevin mentioned, even which authority. And in the middle of this COVID crisis, all of a sudden we're told, no, don't send your information to CDC, send it to Health and Human Services. And finally, our system is one where health care and health insurance is primarily an individual responsibility with costs covered by purchasing insurance. And it's a complicated web by which people seek out insurance. So the US before COVID also has a very weak social protections and few worker rights. 3/4 of Americans live paycheck to paycheck. That there's really no capacity to deal with a crisis such as the lockdown and mass loss of jobs. 4 in 10 adults, even before this crisis, were unable to cover a $400 expenditure in event of an emergency. Compared to the European countries that we've just heard from, we have few guaranteed of employee benefits. We're the no vacation nation. We do not have federally legislated paid vacation time. We do not have federally legislated paid leave for illness, for pregnancy, for medical leave, or other compassionate reasons. Now, from some states do, some states don't, but there's not a national federally legislated paid leave. So it varies from state to state. No federally mandated requirement for employers to provide health care, pensions, or other benefits. And 55% of employees are covered by an employer-sponsored health care, which of course in a crisis where people lose their jobs, they potentially lose their health care as well. And when the crisis is one of a medical pandemic, this can be a real disaster. We also work more hours than workers in Europe or Japan. We have a very low minimum wage, and our minimum wage, which has not changed very much, is actually a third of the average full-time worker wage. And many of the workers who were designated as essential workers came in positions that were very low, and in fact, minimum wage earning workers. 10% of workers, that's over 25 million people, are classified as independent contractors. And that's a designation which removes them. They don't qualify for a lot of employment-based protections, such as unemployment insurance, workers' compensation, and other employment-based benefits. The vast majority of private employees in America are what's called at-will employees. And this is one of the most egregious lack of rights. Essentially, an at-will employee has the right to quit, but they can be fired for any reason or no reason, as long as it's not a narrow group of discriminatory reasons. So this means that workers in the United States coming into COVID had very, very few rights. And one place where workers were able to get rights is if they were able to unionize. But again, the private sector, only 6% of private sector workers in the United States were unionized. Almost everyone else in the private sector is an at-will employee. COVID provided a very interesting systems stress test. It's not the first time we faced a major disruptive challenge, whether it was the global financial crisis of 2007, 2008, HIV, SARS, or in fact, in a more regional basis, some climate change, life-threatening wild weather events. But the scale and impact of COVID-19 surpassed any of these earlier crises. And it hit the US especially hard because of our underfunded public health infrastructure, because of our fragmented medical care system, and because of our inadequate social and worker protections. And as a system stress test failure, there's sort of three areas that I'd like to look at. One is what is needed around political leadership. what's needed around social protections and workers' rights, and what's needed around the healthcare system. Now, political leadership, here I'm not just talking, obviously we need to look at the federal, the national level, and indeed even international level, but in our country at least, the national level, and we can see differences in political leadership from state to state with very different results. What's needed in a crisis like this in political leadership? Well, clearly it's to identify the risk, bring appropriate expertise to develop an action plan around the risk, to understand this is a dynamic situation and it will be changing, but to unite the community and gain full participation in dealing with the risk. In order to deal with the risk, you need to keep the public informed of developments through open and continuous communications and transparency in decision making. Some of the trust comes out of when decisions need to be changed, when direction needs to be changed. People need to feel that it's clear what has happened, what has changed. It's identifying and finding and delivering the necessary resources where they are needed. Not a system of chaos, everyone for themselves, but in fact, coordination. And then finally, as we reach the end or as we point, we need to start looking at what's the recovery? How do we look back and evaluate fault lines in the system and our response with an eye to building back better? And building back better is about post-disaster recovery, risk reduction. There's a number of studies that have been done with this. The UN has a framework called Build Back Better, looking at how to recover from major disasters. The other part of the stress test is, what about the social protections and worker rights? What about healthcare? Well, I would argue that both are in urgent need of repairs. Both have dismally failed in this stress test. With worker protections and worker rights, it starts with decent pay. Many of the essential workers were in fact low-paid workers. They go from hero to zero. They're heroes, but they're not adequately paid and not adequately protected. Well, which is it? We need to look at a living wage, our current minimum wage. If we looked at that wage and we drew it back, we saw it in 1968 dollars. Our current minimum wage would be 98 cents. So we need to look at a wage that is a living wage. There are jurisdictions where we've passed in certain areas a much closer to a living wage, but we need to look at that right across the country. We need to start talking about hazard pay. Again, temporarily things have been brought in, but I think we need to look at that. Paid sick leave. We're asking people, if you are ill, stay at home. But many of the essential workers who are low paid can't afford to stay home with no paid sick leave. So having sick leave without pay really doesn't work. We need to start talking about access to child and dependent care. Again, we want essential workers to be on the job, but essential workers often have responsibilities around childcare, dependent care. And we need to make sure we have a system that provides those services. We need to enhance unemployment benefits. One of the things we did do through the CARE Act and others is we extended to gig workers, to contract workers, some of these benefits for a limited period of time. Well, if we can do it in an emergency, I think we should be doing it all of the time. And we also need support for people who are quarantined, ill, or unable to work. Those supports need to include housing and food support. It's hard to tell people to be quarantined and yet They have no way to look after themselves. And finally, for healthcare workers in particular and essential workers, we need presumptive workers' comp. Anyone who is working, who is a frontline worker on COVID-19 in the healthcare system today, if they become ill, we need to have presumptive worker comp for frontline workers. Other social protection and worker protections include enforcement of the fact that employers are to provide PPE, including not just providing it, but the education, training, and the gear. We need to protect workers from retaliation for exercising their rights at this time. And that means let's look at this just cause dismissal as opposed to at-will employee. And let's strengthen our occupational health and safety rights. You know, in most European countries, they've adopted the three rights model. They start with no retaliation for exercising your rights around issues of health and safety. But then they say, you have a right to know. Well, we have the right to know, but it's really hard to access the right to know without the second right, the right to participate. And the right to participate in decisions around health and safety in the workplace. And that means workers and their unions being able to meet regularly with full knowledge and information of what is happening and participate, not just be told, but actually inform and participate and have some power in those discussions. And of course, the third right is the right to refuse. And we're starting to see this being exercised by workers, even though formally they do not have that right. In particular, in certain areas, we're seeing in grocery stores occasionally, in meat packing, where workers are being forced to work and are just exercising a right by going on strike. Well, it shouldn't come to that. They should have the right to know, right to participate, and right to no retaliation. And the way to do that is by having, again, something that certainly we have in Canada, we have in many other countries in Europe, mandated workplace safety committees. We don't need a crisis like COVID to have this. In workplaces, we should have ongoing workplace safety committees where elected representatives of the workers, whether that's a union or just directly elected from their co-workers, with the power to sign off on bargaining workplace safety plans. Who better, who knows more about what is actually happening than the frontline workers themselves? So they need to be at the table, both giving information, getting information, and signing off on workplace safety plans, protocols, and precautions. And where it's a small workplace where a committee would not be appropriate, few workers, then why not have a mandated safety steward, again, chosen from the workforce for small businesses? And we need in the workplace safety plans that are based on the precautionary principle. Fixing our healthcare system, of course, is a perennial discussion amongst Americans, but I think the COVID crisis really brings it home. We need to protect patients from medical costs due to COVID-19. And those costs are not just for testing and in treatment. I think what we're learning is that many people who get COVID, who will recover, are going to be facing long-term, possibly lifelong medical issues. And it's less of a problem for individuals in countries, in most advanced industrial countries, because they have Medicare for all. And I think in the United States, we need to talk about having and move towards having universal health care coverage for all. We need to stabilize hospital funding and finance and stop the closures. And that means, again, I think Medicare for all needs to be on the table to move from a fee-for-service to global budget funding. We need to restore and fund a strong public health infrastructure. And lastly, we need to establish domestic capacity for production of PPE, medical equipment, and pharmaceuticals. The chaos of not having enough, not having domestic capacity was really revealed in this crisis. And as an economy like the US, not to be able to have domestic capacity is quite shameful. Well, a lot of discussion has been, a real desire to return to normal, that somehow we'll get a vaccine and we'll return to normal. Well, I think COVID exposed that normal is really not good enough, and that I think it quite likely that we will not be returning to normal. One of the reasons we won't be returning to normal is because that many of the problems that we'll be facing in the future, whether it's with climate change and wild weather, will bring very large challenges to our structures, whether it's the healthcare structure, it's our social employment, all of these things. So we need to talk about how do we get to a well-funded public health infrastructure. This exposed our healthcare system. We're already seeing over 5 million people have lost their health insurance between February and May of this year. Many more will continue to lose it because of our system of a majority of workers having their health care insurance tied to their employer. So we need a system of health care for all. And finally, we need to expand the social protections and worker rights so that we get much more participation, so workers are protected in this period. Pandemics come at a unique moment in history. They provide an opportunity and support for large systemic change. And I think the time is right to do that. And we really have a great opportunity to do it right now.